Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today we're talking about something that affects 1 in 5 Americans, Medicaid. You may have seen recent headlines about potential federal budget cuts, but let's zoom in on what exactly that means for Medicaid, who it could affect, and what you can do about it. First, a little context. Medicaid is a joint federal and state health insurance program. It covers low-income children, pregnant women, people with disabilities, and many seniors, offering everything from emergency room visits and hospital stays to prescriptions and long-term care. It's the largest insurer in the country. Roughly 78 million Americans, including nearly 40% of all children, rely on it. It's also a major source of funding for states, bringing in billions in federal dollars. Since the Affordable Care Act passed in 2014, 40 states have expanded Medicaid to cover more low-income adults. The move added coverage for about 20 million people. Public support is strong too. A recent Kaiser Family Foundation poll found that 77% of Americans support Medicaid, making it one of the few bipartisan healthcare programs with wide approval. So what's the threat? Well, Congress is debating a new federal budget, and early drafts suggest a massive cut to Medicaid. The House Energy and Commerce Committee, which oversees Medicaid, is tasked with finding $880 billion in savings over the next 10 years. For perspective, the total federal Medicaid budget in 2024 was about $600 billion. So these are not minor trims we're talking about. We're talking about deep structural cuts. Here's how Congress may go about that. First, work requirements. One proposal would require adults on Medicaid to prove that they're working. That might save money, estimated at $100 billion over 10 years. But it could also kick roughly 1.5 million people off coverage. Arkansas tried this a few years back, and GHLF openly opposed this at the time. And in Arkansas, 18,000 people lost health insurance. Many of these folks delayed medications, and there was no measurable increase in employment. A second idea is federal matching cuts. Right now, the federal government pays between 50 and 77% of each state's Medicaid costs. Reducing that match could leave states scrambling to fill the gap, likely through benefit cuts or shifting costs to hospitals and patients. Another idea is rolling back expansion support. The federal government currently covers 90% of the costs for Medicaid expansion under the Affordable Care Act. Lowering that share would force states to shoulder more of the burden, potentially leading them to scale back programs. So, what's at stake? If these cuts go through, millions of Americans could be affected. That includes people living in poverty, those with disabilities, seniors who need long-term care, and working adults who lost employer coverage during the pandemic or even more recently. When people lose insurance, the consequences are real. There are delays in seeking care, there are skipped medications, there's worsening of chronic conditions, and yes, even bankruptcy for medical bills. Healthcare providers will also feel the impact, facing tighter budgets, possible salary cuts, and staff reductions. So why is this happening, and why is this happening now? Supporters of the cuts argue it's about controlling government spending, and there's no doubt that healthcare is expensive. For example, in 2024 alone, New York State spent over $101 billion on Medicaid. But slashing Medicaid funding isn't just a matter of tightening belts. It's about how we value our public health and who we think deserves access to care. So what's next? Here's the timeline to watch. For the spring and summer of 2025, congressional committees will draft legislation to meet the budget targets. Again, $880 billion in cuts from the Energy and Commerce Committee. In the late summer, Congress is likely to vote on these proposals. In October of this year, final bills will likely go to the president for a signature or a veto. So, what can you do? This is a pivotal moment, but there's a lot of time to act. Here's how. Check in on neighbors or loved ones who may be on Medicaid. Help them with their renewal forms. Sometimes a little paperwork is all it takes to stay covered. Make sure friends and family that you know remain on coverage. Call your representatives. Tell them what matters to you when it comes to public health. There are apps and all sorts of sites that make it easier to find out who your representatives are. There are even sample call scripts and contact information based upon your zip code. Stay informed. Keep up with all the important news by following GHLF on X, LinkedIn, Facebook, YouTube, and Instagram. Medicaid isn't just a line item on a budget, it's a healthcare lifeline for millions of Americans. If the proposed $880 billion in cuts goes through, many will lose that lifeline, but we still have time. Congress hasn't finalized anything yet. So keep watching, keep speaking up, keep listening to the health advocates in all of our podcasts. We will continue to keep you informed. If you found today's episode helpful, share it with a friend or a colleague. And be sure to leave us a review, as it will help more people like you find us. Be sure to check out all of our podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.